I'm Commissioner Christian Leinbach, and I want to welcome everyone to the Berks County Board of Commissioners meeting for February the 25th. We are broadcasting live on BCTV via the Microsoft Teams live event platform. We're also broadcasting on Facebook and YouTube Live. At this time, I'd like to recognize Commissioner Barnhart's Executive Assistant, Jesse Blauser.
Good morning. Public comment will be accepted through the Q&A function. Please include your first name, last name, and municipality. Any comments without name and municipality will not be considered. Each citizen could submit one comment. Comment length is dictated by limitations of the platform being used, Microsoft Teams, Facebook, and YouTube. The meeting comment period is limited to 30 minutes in total. Please be concise. Comments will be read during the meeting and should not be considered to be interactive dialogue with the commissioners. Any commissioner response to public comment will be done at the discretion of the commissioners.
Thank you very much. As always, we will begin our meeting with a moment of silence, followed by a pledge to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. As we do each week, we will begin this meeting with a Berks County COVID-19 data report. It's being presented by Brian Gottschall, the director of our Berks County Department of Emergency Services and the lead on the Berks County COVID-19 leadership team. Brian Gottschall.
Good morning, Commissioner. Thank you very much. And you should have my screen share up now, correct? Great. So yes, our February 25th COVID data review with no meeting last week. We did not have one last week, so this is kind of catching us up for 2 weeks. First slide is all great news, continuing downward trends, not enormous jumps, but week over week over week with small continuing downward trends in all of the various target data areas that are tracked, and that's really great news for us. A little bit of flatlining here in the hospital emergency department visits due to COVID. But again, that matter has been kind of up and down, and since that's also directly affected by why other people are going to the hospital, it's understandable that that particular data point isn't necessarily a direct indicator of COVID in the community. But we'll preview our other slides that we're going to look at here, also really great news. So remember that 3 weeks ago, we decided to stop looking at the graph showing all of COVID from back in last March because there was just so much on the graph that it was hard to kind of see any detail. So I started producing slides that look at only the fall to now. So this, again, this graphic begins in September of last year, not March of last year. But you can see that over the last few weeks, we have made some really considerable progress in getting our case count to be declining. Unquestionably great news. We can't say anything that detracts from that, and we want to make clear to the community that everybody should be excited about this. I guess kind of the one scary part about that is I had some discussions with some of our counterparts in the medical field, and I said, man, you know, what's this all about? It's not like it's May and everybody's getting their windows open and getting out more and not being combined in indoor spaces, which we know is a concern. So like, why are we seeing this sudden downward trend all of a sudden? Certainly we know that use the term carefully, herd immunity is a little bit of it. We have people that have been vaccinated. We have many people that have gotten the disease and have some degree of immunity due to the fact that they've already had it. But it seems that there's more involved here than this. And what was mentioned, which is a great point, is we've had some really serious weather. So yeah, while people were kind of stuck inside a lot more than they might have been, were they stuck inside with the people that they normally congregate with, and therefore we were actually creating an environment where we were we're reducing the spread of COVID due to that sequestration. And as I said, that's a little scary because that means that now that weather is improving, the potential exists that we could see an upward tick in cases. We certainly hope that's not the case. And for whatever reason that we're seeing this downward tick, we certainly hope that that continues on, and everybody, of course, doing their part is the right way to make sure that we do that. Our positivity percentages also on a downward trend from where we were a number of weeks ago, back in the middle of January, seeing a more recent upward tick. One of the questions that we have to look at here is, did that have to do with our public test site that we opened up at Temple Ohev Shalom for a week last week? And we don't have the data back from that test site yet, so we're waiting for DOH to provide that to us, and that'll give us a better indication as to whether that contributed to our positivity. Once again, as we always say, this is our first test positivity, a little bit different than what the state tracks, where they're looking at all the serial retesting. They would say that our first test, that our positivity right now is around 10%. We believe it's really around 30% when you rule out all of those serial tests going on in nursing homes and custodial care facilities. Another slide with some really great news. We see that our COVID deaths are flattening out. Every single one of these, of course, a tragedy, and even more so for the individuals, families, and friends involved. But, you know, kind of stepping back from the emotional side and looking at this in the big picture from the community perspective, we're seeing this graph really begin to flatten out and the slope to start to look a lot more like it was looking back in the late summer, early fall, when things were at a much more reasonable rate. Again, don't want to take away from any single death that happens. Each one's terrible, but got to be a little bit non-emotional and look at it from the data, from the community perspective, to try to understand what's going on. Our hospital numbers continue to look awesome. I mean, I guess awesome is when they're zeros, but the trend in our hospital numbers continues to be awesome as we see downward ticks week after week. This last week, and again, this data is current as of last Friday, so it's almost a week old when we look at it today. But the last week for hospital data was the biggest downward tick that we saw in any given week over week over the last few weeks, where we've seen continuous downward ticks. Our county comparison snapshot really, as it hasn't been, doesn't change very much. Again, this week, we're still at effectively the same place that we've been week over week, per capita for tests administered, cases, and deaths. So moving off from good news or generally good news on to generally bad news is vaccine administrations. Again, you know that we've been looking at this for a few weeks now. As vaccine has become more available, we see Berks dropping again over this last week, down from 12 to 13 in number of first doses administered, and down from 9 to 12 in second doses administered. And very bizarrely, 2 weeks ago, our number of first dose administrations, as reported by the state, which is over here on the right-hand side of the slide, was over 20,000. The number reported right now is almost 20,000. So I have no explanation for how people became unvaccinated in Berks County, except to guess that there were data anomalies that DOH has gone back and corrected. So not very good news that we are taking slow steps backwards. Nothing dramatic, but even one step, 1 week is not good news. Much more, I'm sorry, I should also mention that our vaccine opportunities in the county remain pretty static with approximately 30 locations available. But it's important to note that in the last 2 weeks of distribution, out of those 30 possible locations, only 19 received vaccine. And of those 19, only 5 of them received vaccine in excess of 100 doses. And those are not necessarily first doses. So even some place that got 100 doses doesn't mean that that was 100 opportunities for people to get vaccine, because they may have been second doses for first doses that were already given. So this again is just the overarching summary of the locations in Berks County that have received vaccine from the beginning and the total number of doses that they've received. And we all know the big players in this are Tower Health and Penn State St. Joe's, who have gotten by far the largest number of vaccine allocation of any provider in the county. This is a new slide that we haven't looked at previously, but I felt it was important to bring it to everyone's attention because it really is indicative of the distribution issue and availability issue of vaccine that we have universally. And of course, we're looking at Berks County here, but if you look at this across the Commonwealth, the same problem exists across all counties in the Commonwealth. We see the total number of doses of both Pfizer and Moderna combined that were received in the county in each week going back to the first week of vaccination. And for the viewing audience's edification, this week is what DOH considers week 11. Now you see these kind of week 3, week 4, week 5, week 6 added in under that. Those are the weeks of the commercial pharmacy partnership program. So for some reason, DOH tracks this differently. Everybody else goes under the main number, but then the allocations the small allocations that are going out to the commercial pharmacy program are being tracked under a different model, and so we sum them together. So for example, in week 11, which is week 6 of the pharmacy program, Berks County received a little bit over 3,000 doses of vaccine. That's down from over 9,000 doses back in week 7. And what we see here is a downward trend since week 7, week over week. And part of this has to do with what I'm sure everybody saw in the newspaper about the issue, if you will, with second doses. And we have no indication that that problem existed among our providers in Berks County. But because it was a problem vastly across the Commonwealth, what it did was it affected the ability of everybody to get new vaccine. And you'll see back last week in what the Commonwealth considers week 10, only our pharmacies got a distribution. None of our larger providers got any vaccine at all. And that's, of course, concerning. So we continue to engage with DOH to try to better understand how vaccine distribution is working. We continue to press them to follow through with the commitment that was made, which was that when the feds give the state a better planning picture for vaccine, which the feds are asserting to us that they are doing now. The feds say that they are telling all the states how much vaccine is going to be received in the state in a 3-week block now, which is much better than the 0 notice that they were being given previously. We need the state to pass that information along to our local providers so that they can better plan what they're doing. We've received numbers of phone calls into our office from people who were concerned about the fact that they had an appointment for vaccine and that appointment then was subsequently canceled because the provider didn't have vaccine available. And, you know, the providers are trying to do the best that they can do. The state is telling them, don't schedule anybody until you actually have vaccine in your hand, because there's no guarantee you're going to get it. And I'm sure that the public can appreciate that that puts the providers in a very tough situation. If they're getting vaccine on Monday and they're supposed to be getting it out the door within 7 days, that means that they literally have to plan a scheduling process and get people signed up in just a day or two, which is almost unreasonable. So they're trying to do a little bit of pre-planning, get people pre-scheduled, and then in some cases they're getting burned by the fact that they're not getting a vaccine allocation from the state. So again, we would ask that the public just try to be understanding and see that the vaccine providers are really trying to do the best that they can do in very difficult circumstances and have some understanding with them. That's all I have, Commissioner. I'll certainly answer any questions if you have them, but that's the end of the presentation.
Thank you very much, Brian. Just to follow up on the vaccine issue, I was on a call Monday and then another call yesterday with the County Commissioners Association. The Monday call included representatives from the governor's office and DOH. And one of the issues that we brought up yet again, and we're going to discuss, our task force is going to discuss tomorrow morning with Governor Wolf, is the current vaccination distribution strategy of the Commonwealth. Their philosophy is to get as little, I shouldn't say as little, they want as many little pharmacies out there to have 100 vaccines as possible, and they are not investing time and energy at this point in mass vaccination sites. Their argument to us, specifically Randy Padfield, PEMA director, Pennsylvania Emergency Management, who also was on the call Monday, said this is an equity issue. That and I will tell you, I was offended by this. He said the mass vaccination sites are primarily helping white middle-class people. And we shared, wait a minute, that isn't true. You're putting the vaccine out 100 units at a time to local pharmacies, and we confirmed across the Commonwealth, county commissioners that have, through their EMAs, checked, or their Department of Health, checked with pharmacies. Pharmacies on average are vaccinating 20 people in a day. They're struggling to do both their business of fulfilling prescriptions and vaccinate. They're not set up for mass vaccination. On the flip side, Michelle Kickline, commissioner from Chester County, talked about their Department of Health has done some large vaccination clinics, and they're not able to get enough vaccine from the Commonwealth. And they, Chair Moskowitz, Marion Moskowitz from Chester County, took pictures of their latest vaccination effort, and they targeted the underserved community in their inner city areas. Chairwoman Moskowitz sent those pictures to the governor. We're hopeful he's been able to see them. On yesterday's call, Kathy Dahlkamper, the county executive for Erie County, shared with counties that don't have a health department, Erie is one of the 6 that does, that her frustration is DOH continues to tell them, you have a county health department, you're on your own. And that's not the way this system is supposed to work. DOH is the county health department for the 60 counties that do not have a county health department, and the counties and handful of cities that have a health department are supposed to be working in coordination and conjunction with Pennsylvania DOH. So there is a real coordination issue with DOH, and there's a strategic conflict in the distribution. It is much easier to protect our vulnerable citizens, most vulnerable citizens, with a mass vaccination site, working with partners in Berks, like Berks Community Health Center, than it is to deal with a fractured system of pharmacists throughout the county. And as you demonstrated, out of 31 sites in Berks, 19 received vaccine, and what was it, 5?
Correct.
Five did what?
5 received more than 100 doses.
More than 100 doses. We're in a very complicated situation, and the county commissioners are unified. Again, counties with DOH, with the county DOH, and counties without, in challenging the administration to change their strategy on the distribution and to start focusing on mass vaccination sites. One last thing, and Brian, you may want to share this, the federal government has already acknowledged that strategy and is partnering with Walmart and has targeted Schuylkill, York, Fayette, and Center County in Pennsylvania through Walmart for mass vaccination, and that vaccine is coming directly from the federal government to those entities. And we happen to know the vaccine that's been allocated for Schuylkill County is already fully committed. They're not even going to be advertising. And that's another question we get. People say, why isn't there more publicity? Well, a lot of the entities that are getting the vaccine don't want the publicity because they're already overwhelmed. They have 100 doses, and we're hearing stories of 500 and 1,000 people signed up for those 100 doses, and it makes it very difficult. Brian?
Yeah, I agree, Commissioner. I think that there are a lot of mistakes being made day in and day out, and we're making a lot here. So I don't think we want to poke anybody with sticks. Right. We want to acknowledge that we're in untested ground in many ways among many different agencies and people, and we're making as many mistakes as anybody else. But the lack of coordination and communication does make the process much, much harder. Understanding what the state strategy is very difficult. You know, we're going down a road, taking some leaps of faith and trying to do things that we believe are going to best serve the Berks County citizenry without even any clear commitment from the state that we're ever going to actually have that pay off in the way that we hope it will, but we believe it's the right thing to do. I want to reemphasize to the public, I don't think anybody is out there, you know, giving vaccine to their uncle or their best friend or selling vaccine to somebody that gives them money under the table. I don't think that there's anything quote unquote wrong going on in that way. But the reality is that everyone has a constituency, whether you're a pharmacy with customers, whether you're a hospital who has a normal patient population compared to patients that go to a different hospital, or a doctor's office that serves a local community. There's really only one entity that doesn't have any segmented constituency, where everybody in Berks County is our constituency, and that is the county. And I think that emphasizes the point of why the state needs to relook at counties having a role in making sure that we're able to get vaccine out to everybody equitably. We know how to do this. We do this with access to disaster recovery centers after natural disasters. We do this with distribution of food and water in scenarios where we have those kinds of shortages. We understand how to make sure that the normally underserved folks who are socioeconomically disadvantaged get access to those things. And I truly do believe, I don't think we don't want to shut anybody else down. We don't want anybody else to stop giving vaccine, but the state really needs to recognize the need to have these healthcare agnostic available sources of vaccine for people through, for lack of a better term, a public clinic.
Thank you, Brian. Any other comments, questions? Okay.
I have a question.
Yes,
Brian,
Commissioner Rivera.
Yeah, Brian, spoke about the drop in vaccines in Berks County. Do you have any thoughts as to why that is happening?
Well, I think it's two reasons. Number one, because they're trying to make up for this problem that they had where a lot of providers were giving what were supposed to be allocated second doses as first doses. So in other words, if the state, it's kind of hard math to describe without a whiteboard.
Yeah, and Brian, real quickly, explain, people should not be worried. Did I get a first dose when I should have got the second, or vice versa? There's no difference.
Yeah, that's a great point, Commissioner, because we have seen some confusion with the way the media reported this. So the juice that goes into your arm in the second shot is the same as the juice that goes into your arm in the first shot. It's not like you got a different concentration of dosage or some different formulation. We actually did have people, when the media ran the story about the second dose confusion, calling and saying, well, how do I know if I got the wrong stuff? It's not about clinically what was provided to you. It's about accounting for what was provided to you. So the very simple concept is, if some vaccine provider gave 100 doses out on day one, and 3 weeks later they were supposed to give the 100 second doses to the same people that got the first dose, the state sent them that 100 doses, and they were supposed to kind of put that off to the side and not give that out because it was for those people that had to come back for their second dose appointments. And what was found is that some providers were not separately tracking those second doses. They were giving them as new first doses, and then when it came time to give the second doses, they were having to dip into that week's first doses to make up the deficit. And what you can see is week over week after that happens, you end up digging a hole that you effectively can't dig out of. And that's what the state's trying to do right now, is to dig out of that hole by giving what should be today's first doses to folks as second doses to make up for the fact that they were used up and are now in that kind of negative count, if you will. Anything else, Commissioner Rivera?
Nope, that's all. Okay. Thank you very much.
Thank you very much, and appreciate the great work you do, Brian. We're going to go now to Commissioner Barnhart with an update on Co-County wellness and contact tracing.
Thank you, Commissioner Leinbach, and good morning, everyone. For those of you who are financially astute, the cost thus far since June of last year for Co-County wellness and contact tracing services is $98,590. Compare that to the actual cost if you would add in the cost that would be associated with the fact they have volunteers, would be $154,979. So kudos to the volunteers who step forward to help Co-County wellness. The overwhelming majority of this money has been spent through the CARES Act allocation we received last year from the federal government. The week of February 17th to the 24th, 269 new contacts. They successfully reached 198 of them. So the number's ticking up to 73.5% that have been contacted. Total to date is 8,668 that are documented since the beginning of June. And potential large exposures, what they call line list, are 25. For those of you who are interested in how to safely open schools, the list includes a various number of schools. Let's see, we have Alvernia, Exeter, Hamburg, Conrad Weiser, East and West, Spring Rose, Rainbow, Brandywine Heights, boys basketball, Brandywine Heights, Schuylkill Valley, Governor Mifflin, Kutztown, Ole Valley, Sacred Heart School, Wilson Southern, and St. Catherine of Siena School. So this is still out there. It's still significant in our community. And I know there's a real interest in everyone to try to get kids back to school safely, but it has to be done in the proper manner because regardless of what you hear, that youth are less susceptible, but they are certainly carriers. So there are some really interesting discussions, I'm sure, happening at various school boards across the county, the Commonwealth, and the nation. Thank you.
Thank you very much, Commissioner Barnhart. We'll move ahead with our agenda. Are there any additions or corrections for the February 11th Commissioner meeting minutes and the February 16th operation meeting minutes? Hearing none, the minutes will stand approved as presented. We did have two executive sessions since our last meeting. We had one on February the 12th dealing with personnel and real estate, and one on the 17th dealing with personnel and litigation. Jess, is there any public comment on specific agenda items?
No, there are not.
Thank you very much. We will continue with the agenda. Under item 1, authorizing Budget Department, adopt a resolution authorizing 2021 budget transfers in the amount of $524,040 and 2021 appropriations in the amount of $18,368,252 per listing dated February the 22nd of 2021. We have several items listed under Human Resources. Item 1, authorize the utilization of a temp agency for a payroll analyst in the Human Resources Department. Item 2, authorize the promotion of Grozna Nikel, Senior Governmental Accountant and Team Lead, to First Deputy Controller and Project Manager at the Office of Comptroller. Item 3, authorize the promotion of Andrew Knoll from Senior Governmental Accountant to Senior Governmental Accountant Team Lead, Office of Comptroller. We have one item listed under Commissioner Barnhart, adopt a resolution authorizing the appointment of Pastor Alan Wolkenhauer, Reading, PA, to the Berks County Mental Health Developmental Disabilities Advisory Board for a 3-year term ending December 31st of 2023. We have one item listed under Commissioner Rivera, adopt a resolution authorizing the appointment of Kirsten S. Deischer, Reading, Pennsylvania, to the Berks County Industrial Development Authority for a 5-year term expiring December 31st of 2025. We have a number of items listed under the Commissioners. Item A, adopt a resolution ratifying, confirming, and approving the electronic submission and execution by Ronald Seaman, Chief Administrative Officer for the County of Berks, of the single application for assistance to the Pennsylvania Department of Community and Economic Development for the COVID-19 Hospitality Industry Recovery Program, and further ratifies, confirms, and approves the electronic execution by the Chair and Ronald Seaman of the COVID-19 Hospitality Industry Recovery Program grant contract between the Commonwealth of Pennsylvania through the Department of Economic Development and the Berks County Commissioners to receive funding from PDCED in the amount of $4,770,257. Item B, adopt a resolution ratifying, confirming, and approving execution by the Chair of the, and I'm just going to call it its acronym, CHIRP, program invoice to the Pennsylvania Department of Community and Economic Development, receiving funding from PDCED in the amount of $4,770,257 for the period of March 1st of 2020 to June 15th of 2021. Item C, adopt a resolution authorizing the Chair to execute the agreement between the County of Berks and the Greater Berks Development Fund, an affiliate of the Greater Reading Chamber Alliance, to administer the CHIRP program, subject to final review and approval by the County Solicitor's Office. Item D, adopt a resolution authorizing the Chair to execute the sub-recipient grant agreement between the County of Berks and the Berks County Redevelopment Authority for the administration of the U.S. Department of Treasury's Emergency Rental Assistance Program. Said award is in the amount of $12,549,393.60 and runs through December 31st of 2021. Item E, adopt a resolution authorizing execution of a letter to the Berks County Industrial Development Authority offering support for the Industrial Site Reuse Program grant to assist with the costs associated to prepare a bid package and perform Act 2 remedial actions at the former pistol range in Bern Township. Excuse me. Item F, adopt a resolution authorizing the Chair to execute the memorandum of understanding between the County of Delaware and Southeast PA regional partners, of which Berks County is a member, for the purpose of setting forth terms and conditions with respect to the configuration, installation, and maintenance of a software application and related hardware that will be used to establish bidirectional interoperability between SEPA partners' computer-aided dispatch system to assist with delivery of 911 and disaster recovery services to the public. Item G, adopt a resolution authorizing the Chair to execute a change order to the Motorola contract dated February 16th of 2021 in the amount of $64,963.33 to replace and test/certify new batteries and removal of old batteries at Berks County's 22 radio sites in regard to the Berks County Emergency Response Radio System. This is a 2021 budgeted expenditure. Item H, adopt a resolution ratifying, confirming, and approving execution by Christy Kennedy, Berksheim Nursing Home and Rehabilitation Administrator, of the 2021-2022 Pelican Renewal Quotation. Item I, adopt a resolution ratifying, confirming, and approving execution by Chuck Brantman, Deputy Chief Information Officer, of the Fortinet Evaluation Agreement for the temporary use of certain hardware to resolve technical issues involving the emergency communication system. Item J, adopt a resolution authorizing Berks County Comptroller Sandra Graffius to execute the necessary claim forms and related exhibits to submit to the Pennsylvania Treasury Department for property subject to claim by the County of Berks, and further authorizing the Board of Commissioners to execute a letter of notification of said action to the Pennsylvania Treasury Department. Item K, adopt a resolution ratifying, confirming, and approving execution by the chair of the agreement between the County of Berks and the Delaware County Solid Waste Authority, resolving all disputes and issues in the County of Berks, Pennsylvania versus Delaware County Solid Waste Authority, Chester County Court of Common Pleas Civil Action. Item L, adopt a resolution authorizing execution of a letter of appreciation from the Berks County Board of Commissioners to the Reform Congregation Oheb Shalom for hosting the COVID-19 testing event on February 13th through February 17th of 2021. Item M, adopt a resolution ratifying, confirming, and approving execution of a letter of support to the U.S. Immigration and Customs Enforcement for white paper proposal for the Berks County Residential Center. Item N, adopt a resolution ratifying, confirming, and approving execution by Kevin S. Barnhart, Vice Chair, of the confidentiality and non-disclosure agreement between the County of Berks and Kane Innovations, Kane, Pennsylvania, for sharing certain information or data regarding the internal fencing project at the Berks County Jail. Item O, adopt a resolution authorizing the chair to execute the amendment to the county application for GEMS program funds to the Pennsylvania Department of State for reimbursement in the amount of $65,670 for the purchase of privacy screens. Item P, adopt a resolution authorizing the appointment of Michael S. Rivera as the County Commissioner Representative to the Reading Area Transportation Study Coordinating Committee effective February 25th of 2021. Item 2, a motion authorizing execution of contract agreements and amendments as set forth on the attached listing dated February 23rd of 2021. There are a total of 18 contracts, 1 with assessment, 11 with Children and Youth Services, 1 with the Department of Emergency Services, 1 with the District Attorney, 1 with Facilities and Operations, 1 with Human Resources, and 2 with the Solicitor's Office. And item 3, a motion ratifying confirmed payments as set forth on the Comptroller's Office voucher listing. It's dated February the 16th of 2021 and February 23rd of 2021, and the payment of electronic transfers and employee payroll.
Motion to approve the agenda as presented. I will be voting no on items 71, 2021K and 73, 2021M. I have grave concerns with item K regarding the landfill, Delaware County Solid Waste Authority, which I'll probably put in more detail in my comments at the end of the meeting.
Sure.
Thank
you. Second.
The motion has been made and seconded with the noted exceptions. Is there any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Opposed? The motion is carried. Our County Treasurer, Dennis Adams, is not available, but in his place, we have his deputy, Linda Weaver. Linda?
Good morning.
Good morning.
We have an opening balance of $167,531,766.39. We have a balance to clear of $3,161,348.64, leaving us with a balance of $164,370,417.75.
Thank you very much, Linda. We'll go now to our County Controller, Sandy Graffia. Sandy?
Good morning.
Good morning.
We have 2 reports today, as you mentioned, one from February the 18th. We had total accounts payable of $5,937,407. We had a payroll, $4,730,783.90 for a grand total last week of $10,668,190.94 for this week. There was no payroll. And we have a total accounts payable of $10,044,968.84.
Thank you very much, Sandy. And at this time, we will move to our Chief Administrative Officer, Ron Seaman.
Thank you, Commissioner. There's nothing that needs to be reported at this time.
Very good. We'll go to Commissioner's comments, and we'll start with Commissioner Kevin Barnhart.
Thank you, Commissioner Leinbach, Commissioner Rivera, and everyone who has joined us. A couple of circling back items here. Just so everyone's clear on the purchase of privacy screens through GEMS, that was for elections. That was item O. And I want to thank Commissioner Rivera for replacing me on the RATS committee, the Transportation Coordinating Committee. We're working as a real team here, the three of us, and we're trying to level out the workload. A lot of these responsibilities we're trying to balance out. So thank you, Commissioner Rivera. You'll be a real asset to that body. My earlier comment and no regarding the landfill, the Delaware County Solid Waste Authority. I just have a real philosophical issue with the landfill. As many of you know, we're probably landfill capital of the world, having 4 landfills, active landfills in Berks County, where the overwhelming majority of refuse comes in from out of state. Actually, Conestoga takes in mostly the trash from New Jersey and New York. And of course, Delaware County Solid Waste Authority decided many years ago in the 1980s to take by eminent domain a landfill which exists in Earl Township to actually deposit their fly ash from their incinerator. So it's interesting, I was reading through the Johns Hopkins study on the feasibility of a health department in Delaware County, and they note on page 23, incineration is currently the waste management modality of choice for Delaware County. Although incineration reduces the total mass of disposal waste, it negatively impacts air pollution. The American Lung Association in its 2019 State of the Air report gave Delaware County a passing grade overall, with an F for ozone pollution and a B for particulate pollution. Why I bring this up is, you know, as far as I'm concerned, we're not hauling trash to some other county, but Delaware County sees fit to send their fly ash to us, which, if you don't know, fly ash is highly concentrated. There are a lot of minerals and materials in there that are really highly concentrated when there is this residual deposit. Again, back in 2018, the community leaders of Boyertown came to our commissioners' meetings on a frequent basis, pleading with us to do something about the closure of that landfill. It was ruining property values. It was ruining the roadway. There was dust, there was pollution and noise and traffic. And now, in a matter of 2.5 to 3 years, apparently Boyertown, as far as I'm concerned, I guess money talks. Apparently they have a side agreement with Delaware County Solid Waste Authority. So the landfill will continue to exist for many years to come with this agreement. And I honestly think we have probably 3, if not 4, too many landfills in Berks County. I won't go into any more detail, but I just think it's not in the best interest of the environment and the community here in Berks County. Thank you for letting me indulge there a little bit. Just to bring my colleagues up to speed and some of our listening public, pursuant to the article the other week from Karen Shuey in the Reading Eagle about us looking at the possibility of creating a Department of Health, I have started to do some investigation, some research with the thanks of Jessica Blauser, my assistant. We have thus far gone through Act 315, which is a very interesting act, which establishes county level or municipal level health departments, gone through the Allegheny County Health Department Health Initiatives Program, and have been working through Delaware County's information. Myself, Jessica Blauser, and Brian Gottschall had about a 50-minute discussion with representatives of Delaware County yesterday to try to gather where they are and how they got to where they are. It was very informative, very helpful. There are various differences here that I may not want to go into detail at the present time, but some of the highlights. For example, Allegheny County did an updated health needs assessment in 2015. The population of Allegheny County is 1.2 million people. The survey was completed by 1,081 people. They had 14 public meetings, of which 400 people showed up. And then they just devised their graphs and their measures for low birth weight pregnancies, smoking, binge drinking, sexually transmitted diseases on down the line, and looked for goals to establish to lower those numbers. And I've said this all along, a Department of Health standing on its own as a county is never successful unless you have the buy-in of the entire community to do something like this. Delaware County, interesting. I thought they were very forthcoming with their information. They actually had a study done by Johns Hopkins back in 2010, but did nothing with it. So they went back to Johns Hopkins in 2019, prior to all of this occurring with COVID-19, and had them do another evaluation. At this point, they really have no idea what it's going to cost them. It doesn't seem like that's really much of an issue for them. They're not really concerned about the cost factor. They believe they can get some federal and state reimbursement, of course, through Act 315. And my concern with Act 315, with 6 county health departments and 4 municipal health departments, as more counties or municipalities add on to that, that pie is only so big. So as that pie continues to get cut up, there is less and less reimbursement back from the state. And quite honestly, the state, if they are advocating for county and municipal health departments, they need to put their money where their mouth is. They said they were very receptive, met with Department of Health, very receptive for Delaware County to start up a county health department. But again, they had a request for information. They hired Johns Hopkins Public Health, Bloomberg School of Public Health to do an evaluation. Here again, 565,000 Delaware County residents, 1,795 responded to the survey about the needs of not a health department, but the health needs of Delaware County. They found that the overwhelming majority of people that responded were older white females, highly educated homeowners, full-time employees with health care. So I say all this to say that we have a county of 420,000 people. For us to even consider not doing a request for information and understanding a real drill down into the details and literally asking 1,000 people their opinion or 1,795 people their opinion in a county of 420,000 people would have to be an absolute requirement of any firm or organization that would even do a reality check. It's very good information. The report from Delaware County is about 158 pages, a lot of graphs in the back, and they actually measured Delaware County with Chester County, with Montgomery County, Berks County, York, Baltimore County, Maryland, and New Haven, Connecticut to do some comparisons across the board with health outcomes. So again, a lot of research has to go into this decision making. We can't just simply snap our fingers and say, hey, wouldn't it be nice if we had a county health department? There's an awful lot that goes into it. They don't know how it's going to cost. Delaware County, again, focusing on them, don't know how much it's going to cost. Question was, how many employees do you see in this department? We don't know yet. We haven't made our formal application to the state, but the state's supportive. There's still a lot of legwork to be done. They actually started this in 2019 as an update to the 2010 plan. And then elections, I think 3 new councilors were seated, Commissioner Leinbach. They went ahead and said, regardless of the outcome of the study, we're going to pursue a county health department. So I honestly respect them tremendously, but I think in some respects they're flying by the seat of their pants to try to pull this together. I guess questions remain. How do you lower people smoking? How do you go out into the community and do these things to say to somebody, because we now have a county health department, we're going to lower the smoking population by 10%. There are a lot of things that go into this, and you take on all the responsibility. There are 15, if not 20 different disciplines that the state does now for the 61 other counties. So we assume all that responsibility, all that risk, all that liability, all that financial burden to do this work. Again, I'm going to read through more data, go through a lot of information, continue to watch Delaware County. It was interesting. One of the questions was, They have 26 vaccination sites in Delaware County. 2 are run by the county. And I said, well, how do you get your vaccines? Well, we think it's, I said, it's because of your relationship with Chester County. Well, we think it is. We think that's why we get vaccines for those 2 locations. Again, they've got pharmacies, Giants, Wegmans, and things similar to what we do to administer vaccines. So again, it'll be interesting to see their process. They started in 2019. They're hoping to be up and running by January of 2022 with the county health department, but they're actually slogging through. They're doing them meeting by meeting with constituent groups like fire and EMS and all the other organizations in Delaware County to pull them into this, and whether it's something they want to be a part of. And I've said this all along, that if you don't have the dentists, the healthcare providers, the schools, the restaurant, you have to have everybody involved, because you become the inspector for all of these facilities, the restaurants, the bars, the food processors, the food handlers, the recreational pools, the campgrounds. You're pulling a lot of these responsibilities, not just away from the state, but municipal government, and putting this under one umbrella of county government. So a lot to think about. I know people generally are saying, well, if we had a county health department, things would be better. I would say to you, possibly, but there's still a lot more information for me to glean through here and go through the other various departments and see if this is something even worthwhile to put out for an RFI. So a lot more to come. I just wanted to fill my colleagues in and the general public as to the process we've been taking here thus far to try to gain more knowledge of the process. Thank you.
Thank you, Commissioner Barnhart. Commissioner Rivera.
Yes, thank you, Commissioner Leinbach and Commissioner Barnhart. Thank you for your insights into the health department, for starting that research and for sharing that information today. It was very interesting information. I know I've committed also to looking into it as well. So thank you for sharing what you have here, and also for the opportunity to serve on the RATS coordinating committee. I'm looking forward to that. Get more involved in the transportation areas here in Berks County, so it'll be a great opportunity. Also want to thank and welcome Kirsten Deischer to the IDA board. She will be a great addition to that board, so looking forward to her serving. It's become official today, so as of today, she will be serving on that board again. Kirsten, welcome to the Berks County Industrial Development Authority board. Just 2 things shortly. And they were voted on today in some aspects. The CHIRP, which is the hospitality grant that will become available, that will start on March 15th. We will have more information on that coming up shortly. We're still finalizing all the details with the Greater Berks Development Fund, which is part of the Greater Reading Chamber Alliance. So please stay tuned. We will have more information. We'll share that. More information will be on the Do Your Part Berks website, as well as the Greater Reading Chamber Alliance website as well. As for the rental assistance program, the start date has changed from March 1st to March the 8th. We did get a $12-some million allocation from the federal government. We are expecting to get another 15 million, a little over 15 million from the state as well. That's still being worked on. We don't know what the guidelines are yet for that part of the money, but it is something we're working on. So more information will be on that as well on Do Your Part Berks website, as well as the Berks Coalition to End Homelessness website, hopefully within the next week or so. So if you do have any questions, please feel free to visit those websites. You can also send us an email here or reach out to my office as well, and I'll share any information and try to answer any questions that you have. Commissioner Leinbach, that's all I have. Back to you.
Thank you very much, Commissioner Rivera and Commissioner Barnhart. Just jumping on the Department of Health issue again, we are committed to properly and deliberately review and study this issue. That's really the way we should view any decision that's going to impact our county, impact our residents. Yesterday, this was on was a topic that came up on the County Commissioners Association call. The call yesterday was not with DOH and the governor. It was a statewide call. I believe Barbara Lopez, Commissioner Rivera's assistant, was on that call. And two things came up. One, Percy Doherty, a commissioner from Lehigh County, shared the experience of Lehigh and Northampton with the support of the state back in 2007, and actually prior to 7, I think it took 2 years, went through an extensive process to consider a joint county DOH joint county DOH with Northampton and Lehigh. They went literally all the way up to the point where the next step was to formally vote to approve it. And they voted against it. And the reason was in 2007, according to Percy, the annual cost to Lehigh County would have been $8 million. So that was a little surprising. I've been dealing with estimated, and that's all we have right now. Until you do a full study, we're not going to know what the cost will be. But I've been dealing with estimates of $4 to $6 million based on discussions I've had in the past with Chester County and some other counties. Second thing that came up, there are some counties, more rural counties, that are looking at a regional multi-county Department of Health. I was not aware of that. That is something that's being considered. And then finally, the County Commissioners Association's virtual spring conference later in March is going to have a workshop dedicated to all the ins and outs of what is involved in doing a study, in looking at a county health department, pros and cons, etc. Now, whether you're pro or con, I don't want anyone to misrepresent what I'm saying. I'm simply sharing that CCAP is working to provide information to counties. This information is not going to come close to taking the place of a formal deliberative process that the county would need to take. I will be very clear. I have not believed that there is a need for a county Department of Health, and other than discussions with Kevin Murphy and the Berks Community Foundation and their study early in my first term, there's been no outcry for a Department of Health. Even in our last election in 2019, it didn't come from the public, it didn't come from the candidates, there was no discussion. That doesn't mean that we don't need one. I'm simply pointing out that the current drive around a Department of Health is driven by the current pandemic, and I get that. But we need to work with real, verifiable data. We're committed to do that, and we're committed to work with statistical reports that are statistically valid. I really don't care about an online survey that included 40, 50, 100 people. I don't really care about studies that are done that don't have statistically valid data to back up recommendations. We need to work with statistically valid information, whether we're talking about research or we're talking about feedback from businesses, feedback from our community. Secondly, I want to highlight the settlement between Delaware County and the Rolling Hills Landfill and the County of Berks. This is based on a lawsuit around a decision a number of years ago of Rolling Hills to put an expansion application into DEP. The agreement between Rolling Hills and the County of Berks is over 30 years old. And in our opinion, and in the opinion of our legal counsel, clearly gave the right of the county to approve or disapprove a lateral expansion. When it was clear they were not going to come to us and seek our opinion, We took legal action to enforce our right to approve or disapprove that expansion. Shortly after we did that, Rolling Hills withdrew their application and put a new application in claiming that it was not a lateral expansion and it was a vertical expansion. It was after that point in time that Boyertown came, or leaders from Boyertown came to a commissioners meeting to express their concern with the truck traffic and the impact of truck traffic from the landfill on their downtown area. We listened to that. We appreciate and understood that issue. We did have multiple discussions about alternatives. At the same time, the lawsuit was going forward. Ultimately, Boyertown, without the county, Boyertown and Rolling Hills began to negotiate on a financial settlement that would provide dollars for repairs to infrastructure, roads, et cetera, that were impacted. And ultimately, I think it was late last year, they came to an agreement. However, that agreement was dependent on a conclusion to the legal battle between the county and Rolling Hills landfill. I think what is important for the public to know is that the county won the case. Yes, we settled, but we got everything that we asked for. We wanted the complete repayment of the past host dues, well in excess of $1 million to the county. That has been agreed to. We asked to clarify the language in the contract guaranteeing the right of the county to approve or disapprove any expansion. Not only did we get the clarifying language, the new language gives us the right to approve both a lateral and or vertical expansion. And then finally, we wanted a settlement that would make the county whole relative to its legal expenses, and that demand was also met. So from where I sit, the county did the right thing. We stuck to our guns. We were able, in the end, by sticking to our guns, be in a position that Boyertown has what their leaders were looking for, and the county has protected the financial position of our taxpayers with the past host fees, and the host fees will continue going forward. We've strengthened, if anything, the language in the agreement that gives this board and any future board the absolute right to approve or disapprove any lateral or vertical expansion. And then we also have financial remuneration that will cover the cost of our legal fees. I also want to note that on Monday afternoon, Berks County, Chester County, and Montgomery County representatives met virtually. We discussed the restoration of passenger rail service, and the decision was made to go ahead and form a tri-county passenger rail committee. We'll have a 9-member board, if you will, or committee, 3 from each county. Recently, we announced the members from Berks, our Deputy CAO and Berks County Director of Economic Development, Pamela Schupp-Manette. Also, Jim Gerlach, who is President of the Greater Reading Chamber Alliance, and then myself as Commissioner Representative. The board also organized. I will be chairing the Tri-County Passenger Rail Committee, and Commissioner Marion Moskowitz and Commissioner Ken Lawrence will be co-vice chairs on that committee. There will be more information to come. We plan as a committee to meet on a monthly basis, and then subcommittees meeting on the interim. We will be talking about this more in our future meetings, but I feel it's very important that this process be deliberative, thorough, and transparent. I think the public needs to know what is going on, what's being considered, what's being discussed. So I will be working to do that to the best of my ability, representing Berks County, and I know both of my colleagues representing Berks County feel the same way. That is all that I have. We'll move now to row officers. Do we have any row officers' comments? Hearing none, we will go to public comment, and I want to once again recognize Jesse Blauser, Executive Assistant to Commissioner Barnhart, to read our public comment.
Wayne Lesher, Burnville. Thank you, Commissioner Leinbach, for clearing up what appeared to be suspicious votes recorded after Election Day at the last public meeting. Considering you named election reform the #1 issue for county commissioners across the state, I can only assume that you would agree that there were very serious problems that need to be dealt with. As you know, regardless of fraud, Pennsylvania is vastly red with the exception of Pittsburgh, Philadelphia, and State College. Consider Trump won 54 Pennsylvania counties with large margins, and Biden won only 13 counties with smaller margins. A fairer way to choose electors would be to follow the model of Maine and Nebraska, who choose electors by district. The state legislature can do this through resolution, eliminating the need for the governor's signature. Please look into this option when meeting with the state officials. Thank you for your time. Fred Zentgraf, Senior, Berkshire Heights. Greetings, Commissioners. Commenting recently via this forum on 11/3/2020 election fraud travesty at this time, I would like to add, per a pending class action lawsuit, Berks received $417,000 grant from the Zuckerberg-funded organization CTCL. This issue needs to be addressed. A search of the gatewaypundit.com website for group Our Vote Matters is suing Facebook, Dominion, Mark Zuckerberg, certain state officials, and others. We'll have all the details. The following is from those details. 74, a general breakdown of the grants awarded in the relevant states. Herein include A, Georgia counties, Cobb, 5.6 million, Fulton, 6 million, Gwinnett, 4.2 million, Dougherty, 300,000, Macon, Bibb, 557,000. B, Michigan counties, Wayne, 3.5 million, Ann Arbor, 417,000, Flint, 467,000, Lansing, 443,000, Muskegon, 433,000, Pontiac, 405,000, and Saginaw, 402,000. C, Pennsylvania counties, Allegheny, 2.02 million, Berks, 471,000, Center, 863,000, Delaware, 2.2 million, and the city of Philadelphia, 10 million. D, Wisconsin counties, cities, Milwaukee, 2.15 million, Madison, 1.27 million, Green Bay, 1.09 million, Kenosha, 862,000, Racine, 942,000, Janesville, 183,000. A free and fair 11/3/2020 election would have continued and improved upon President Donald Trump's accomplishments, some of which follow. Before the Chinese, in parentheses, Communist Party, virus invaded our shores, we built the world's most prosperous economy, achieved 40 months in a row with more job openings and hires, more Americans reported being employed than ever before. Nearly 160 million jobless claims hit a nearly 50-year low. The number of people claiming unemployment insurance as The share of the population hit its lowest on record. This is a small part of the January 2021 White House showcase list. The current administration policies will have a negative impact on these positive accomplishments to the detriment of our prosperity. Thank you and Godspeed, Fred Centigraph, Berkshire Heights. Dwight Wegman, Lower Heidelberg Township. An investigation of electronic voting machines, including the ES&S machines used in Berks County, indicates they can be accessed by the internet. I would like to know what the commissioners, and specifically Commissioner Barnhart, who oversees the Board of Elections, as I understand, is doing to prevent hacking of the machines and the vote tabulations going forward. There are many issues regarding voter integrity, and we need to take action now so that the voters of Berks County can have the utmost confidence in the legitimacy of our elections. Thank you. Linda Brancadora, Byrne Township. The coronavirus pandemic is one big stew pot. The sometimes confusing information that emerges points to a lot of cooks stirring the soup. On the state level, there is the Pennsylvania Department of Health, which coordinates information from 67 counties, plus hospitals and nursing homes and personal care homes and labs and corners and more, and distributes it through multiple websites as well as news conferences with the Governor and Secretary of Health and communication directly with various agencies. So why do we need a separate Department of Health? Answer, we don't. Why? Additional taxes, additional government, and how do we then do away with our current system that is very effective? Liz Cates, Byrne Township. Polling indicates that a majority of the Republican voters believe the big lie that the presidential election was stolen from Trump and that Joe Biden is illegitimate president. And many Republicans in positions of leadership still have not denounced that erroneous claim. Commissioner Leinbach, will you issue an official public statement to set the record straight that there was no evidence that Biden's win in Pennsylvania was fraudulent and that Biden's victory was secured fairly and squarely? Crystal Kowalski, why missing? Good morning, commissioners. Yesterday, I read the article on Operation Nightlight and found it disturbing. Some of the language in the article felt inappropriate. It conveyed a certain subtle satisfaction in punitive measures. Operation Nightlight espouses increased patrols of people on probation and parole, as well as enhanced sentencing recommendations for people associated with gangs. These two measures would accelerate mass criminalization and mass incarceration. The Berks County Gang Task Force also plans on initiating an education and training program for elementary and middle school age children at risk of joining gangs. Will this be in all schools? Will children be chosen to participate in this program? If so, how? What is the curriculum and who developed it? Who will be facilitating the program? I believe it would be necessary for the people developing and conveying such an important message to be a trusted member of the community. Instead of repeatedly implementing punitive measures that drive up incarceration rates, do nothing to deter crime, and disseminate communities, we could choose to allocate resources to community programs that provide a sense of belonging, require employers to pay a living wage so families can exist with dignity, provide community health care, and ensure safe, affordable housing. All these things have proven to lower crime rates. To lessen the number of guns on the street and in our community, we have the courage to pass sensible gun control legislation. I agree that we need to be proactive to stop violence. I would like to see Berks County choose to do that in a constructive rather than punitive way. Thank you. John Archer, Spring Township. A few of many issues which must be addressed when evaluating the real need for a county health department. First of all, would the creation and establishment of county health department fulfill a must-have or simply a nice-to-have level of need? What are the other alternatives and what criteria
would be used to determine if it should be dissolved in the future in the event it was ever created? Second of all, what would the charter and role for this organization look like? Would it focus on delivery of key functions which provide really essential regulatory established government documents, systems, services, or law enforcement needs of a civilized society as other of our county's departments do? Would it simply become a self-serving political entity that provides services of very questionable value and just offers hope in lieu of substance? Third of all, how would this department ensure that it stays focused on its authorized chartered functions to effectively and efficiently provide the key functions throughout the county, which obviously have varying needs? Or will it just become a self-serving, bureaucratic government organization that places its emphasis and focus on political bias services, gatekeeping functions, and determining who truly benefits from whatever services it is chartered to provide? Fourth of all, who would this health department serve? Will it truly work to serve the citizens of Berks County, or would it instead be more aligned with certain health service providers who it has determined to be the most deserving, according to its own judgmental criteria? Fifth of all, would the individual who would hold the position departmental director be an elected official who is accountable to the citizens of the county? Last of all, what would ever prevent such a department from not just performing its key and limited functions, but instead becoming a bloated organization? Becky Ellis, Reading, PA. Good morning, Commissioners. I come before you today to ask if you had prior knowledge of the December 15th, 2017 final focus remedial investigation report for the Price Battery Superfund site, operable Unit 3 for Hamburg, PA. I have taken an excerpt from the 940-page document which states the following with regards to Karcher Creek Park. The quality of lead-contaminated soil and waste at Karcher Creek Park is currently unknown, and EPA's ongoing investigation will better estimate the quantity and extent of contamination so that human health and ecological risk may be properly assessed. Again, I want to reiterate that this document is dated December 15th, 2017. In October of 2020, I called and emailed both Representative Knowles and Senator Argle's offices. As soon as I mentioned the word lead in my phone conversation to the representative at Senator Argle's office, she verbally referred me to Congressman Muser's office, even after I had asked her if Senator Argle's office would put me in contact with the DEP. Per the joint letter from Representative Knowles and Senator Argle to Congressman Muser dated October 29, 2020, on which I was CC'd, it was stated, Ms. Ellis has concerns regarding lead exposure due to remediation projects versus complete removal of lead. Due to the nature of this matter and the fact that the EPA and lead remediation falls under the purview of the federal government, we wanted to forward this correspondence to you. When I reached out to Congressman Muser's office, I was told that there was nothing that he could do to advocate on behalf of Karcher Creek Park because there was currently no open case with the EPA and that he could not open one. Commissioners, I come back to you today because I had first addressed you nearly 6 months ago, which is when you had told me to go to the local representative for Hamburg. The local representative, state senator, and congressman have stated that they are unable to assist me or the Hamburg committee. You represent Berks County. I'm asking for help in getting Karcher Creek Park tested for lead contamination. Thank you, Becky Ellis. Christina Worley, Cumru Township. No to any more discussion about a county health department. We don't need to be taxed more. No to participating in the gun buyback promotion by the city. The guns are not our buyback. The guns are not ours to buy back. Luis Graham Y. Missing. Good morning, Commissioners. As we continue to deal with nationwide and statewide with this pandemic, Berks continues to struggle in order to vaccinate the 1A group. I personally know that people in their late 70s who are still waiting for an appointment, and these are people who know how to use the internet. How many more are not technically savvy enough to do the same? My husband and I have received our second shot in Lehigh Valley 2 weeks ago. When I was co-coordinator of the Pandemic Advisory Council in 2017 through 2007 through 2009, one of our key requests was a county health department. 14 years later, we are still waiting with nothing being done in the interim to study the issue. Now is not the time to delay studying this critical issue. We need to study it now. While the reality of not having a county health department and its consequences is fresh in our mind. And that's the last comment.
Thank you very much, Jesse. We will close comments at this time and give an opportunity for those that would like among the commissioners to comment. I do want to make a couple comments on questions about the way Berks County ran the election. Some of the people listening may not be aware that I think beginning of the year sometime, the Berks GOP reached out to me and had a number of questions, including questions about the accessibility of our machines to the internet. They asked for a meeting. We ultimately put together a meeting on the 13th floor of the Commissioners Boardroom. We were socially distanced and masked. That was strongly enforced. We had representatives present from our elections department. All three commissioners were present. Only I spoke. It was not a deliberative meeting. The other two commissioners wanted to be there to observe and hear. We also had representatives present from ES&S. They're the manufacturers of the machines and the software, creators of the software. And we had their top, I guess, tech expert on Microsoft Teams from Nebraska. The three people in the room from the Berks GOP were Dean Klopp, John Wojcik, and John Archer. John Archer actually is, at least posted a comment here. And we allowed them to ask any questions that they wanted to ask. Almost all of the questions were answered that evening in great detail and to the satisfaction of the individuals present. They indicated that to us publicly. And there were a handful of questions that we didn't have the answers to that we committed to provide to them later. Those questions were answered in detail and sent back. I am confident that the Berks County election was above board, done very well, that there was no election fraud, there was no flipping of votes in machines. The results, I believe, are correct in Berks County. I would suggest that you reach out to the Berks GOP and ask them about the details. Commissioner Barnhart was present for that, and I can speak, I believe, for all three commissioners. The detail and the care that we took in this election and prior elections. It's the first time I heard a step-by-step explanation of what it means to certify and secure and seal a voting machine before the election. That was explained in great detail. It was explained in great detail why these machines are not connected to the internet, cannot be connected to the internet. They are not Wi-Fi capable. They are not Bluetooth capable. They use in the transferring on the flash drive, Department of Defense level encryption so that that information can only be read by properly encrypted equipment. I just would encourage people to understand there is a tremendous amount of work done by Berks County. Now, let me also make another thing clear. Did Berks County do everything perfect? No, we didn't. And we reached out to all of the observers, and we've heard from many of them, asking for their recommendations. What we can do differently at the polls, what we can do differently when pre-canvassing mail-in and absentee ballots. And we are incorporating some of those recommendations because we want to do and handle our elections in the best way possible. I'm proud of what we did, and I'm proud of the fact that we're not afraid to say, yes, that wasn't done well. One of the examples, we never dealt with counting ballots in a ballroom of a hotel. And so we were set up in a way that the observers were at some distance from things happening on the other side of the room. We're working to resolve that so observers can be closer. We can't have the observers leaning over somebody counting or leaning over a machine or having access to a machine, but we can do a better job, and we've made that commitment. And I will tell you, Commissioner Barnhart has done a significant and wonderful job leading the election board. Something that you should understand, though, just because he chairs the election board doesn't mean that he makes any decisions on his own. Every decision, just like the commissioners, is a majority decision. We make these decisions together. He's done a great job leading us. He, if you haven't figured this out about Commissioner Barnhart, he's a detail guy. You've heard him explain about the Department of Health. He loves to dig into the weeds, and that is a very good thing. He did the same thing in researching our machines. I looked into it, but not to the extent where I went to Tennessee to observe one of the races, went to Kansas to observe another race. Different machines were being used. I think one, you can help me out here, I think Unison was the machine in Kansas, and I believe ES&S was in Tennessee.
Correct.
And he was the one that suggested, let's have the public look at these machines and our poll workers look at these machines. And so we set up public opportunities for people to review both the Unison and the ES&S machine, and they were the finalists. We did look at Dominion, and we looked at another company, I don't remember the name. So again, the three people that were in the room, and I think John Wojcik was kind of the key tech guy on the Berks GOP side. They asked every question they had. We stayed until they didn't have any more questions to ask, and I believe we answered every question, either in person and a handful of questions afterwards in great detail. That's all that I have.
Thank you. I just want to comment back to Becky Ellis regarding Kircher Creek and the lead contamination. Certainly I can discuss this with you at length offline, Becky, if you want to contact my office to give us dates or times we can talk through a Zoom call, be perfectly fine. Just as an aside, we received a letter or an email from David Hunter, our planning director, about the Exide action out in Laureldale. Good morning, commissioners. As you know, staff prepared a letter to Governor Wolf for your signature in September regarding the lead levels in soils near the site of the former Exide Technology secondary lead smelter in Laureldale. To date, we have not received a response to this letter. In addition, Fred Osman sent a letter to EPA project manager Kay Dow in July of 2020 which provided an expert review of the proposed cleanup of Exide and recommended action to EPA regarding this cleanup. So it's a tough slog, Becky. Trying to deal with bureaucrats and elected officials above us is a challenge, but I'm more than willing to talk to you about this, kind of talk you through this, and try to help you in any way I possibly can. I'm not committing my colleagues, but I'm just saying I understand your frustration, but likewise, there's frustration with people in Laureldale as well who want some satisfaction. And when the governor doesn't respond since September, gives you an indication as to how long these things will take to get some response from those who can do something about the lead contamination. Thank you.
Kevin, and maybe you didn't see this. There is information at the bottom of that email from Kai Dow, EPA project manager.
Right.
And let me just look here. He acknowledged that they received their comments and also noted the following. Please, and this is dated February 24th, so this is from yesterday. Mr. Osmond, please be assured you are not the cause of the delays, referencing the delay in the response. As you may already know, Exide filed for bankruptcy last summer and is no longer a viable entity. As a result of the bankruptcy settlement in October 2020, the court established an environmental trust fund and appointed a trustee to address the environmental liabilities at the site. The funds in the trust are limited and do not sufficiently cover the costs of the proposed remedy. We are currently working with the trustee, PADEP, and the EPA Superfund program to establish a scope of work to stabilize the site with the goal of finding a buyer to address the environmental cleanups. When we finalize the coordination among the programs to stabilize the site, we will schedule a public meeting to update the community. In the meantime, do not hesitate to contact me directly if you have additional questions or concerns. So, and I think the pertinent component here is Exide. Exide, I believe, is the last entity responsible for the battery issues in Hamburg, not just Kircher Creek, but there's a former Exide property, I guess right there off of Grant Street as well. So this is an issue I would say stay tuned. This is clearly in the EPA's hands, and we'll see where they go. He clearly notes that there is not enough money to do all of the cleanup projects, I assume across the country is what he's referring to.
Well, Commissioner Leinbach, they keep referring back to Exide, but there's no way they're going to ever amass any sort of money to do any cleanup. That's where the ping pong game starts, back and forth, back and forth. They're never going to do it. Right.
And the thing to keep in mind, we knew that the cleanup that was done in '99 at Kircher Creek was not done properly. It wasn't a removal, it was a mediation or remediation, not mediation, a remediation of the issue. And that's one of the reasons we said we are not going to go forward with Fish and Boat unless we are indemnified for any previous existing conditions. We know that the most recent cleanup was not, again, a cleanup. It was a remediation of the lead contamination, but they're still there. Yep. They're just stabilized, I guess, is what they would say. So it continues to be a problem, and we've provided kind of the latest information, I guess, both on Laureldale and as it impacts Kircher Creek and Hamburg. Anything else? Any other comments?
No comments from me. What I was going to add has already been covered, so we can move on.
Very good. Okay. Motion to adjourn?
Second?
The meeting stands adjourned.